Bismillahirrahmanirrahim. So we discussed about rheumatoid arthritis, then osteomyelitis and gouty arthritis in previous lectures. So today we will discuss about seronegative spondyloarthropathies. They are associated with HLA-B27 allele and triggering infection, but without specific autoantibodies, so they are seronegative. They are immune mediated, triggered by a T cell response directed against undefined antigen that may cross-react with native molecules of the musculoskeletal system. So all have inflammation of synovial joints and share overlapping clinical features with extra-articular involvement. So, and they are of different types. So one is ankylosing spondylitis, then reactive arthritis, that is REITER syndrome and enteritis associated arthritis, psoriatic arthritis, arthritis associated with inflammatory bowel disease, that is ulcerative colitis and Crohn's disease. So ankylosing spondyloarthritis, HLA-B27 patients, they have HLA-B27. 90% of the patients, they are male more than females. And sacroiliac and hypophyseal joints, they are more commonly affected. Patients present with low back pain. There is chronic synovitis and then destruction of articular cartilage, which may lead to bony ankylosis, especially the sacroiliac joint. And there is fusion of the vertebral bodies and bony outgrowths, and then spine is immobile. So complications, involvement of peripheral joints such as the hips, knees and shoulders, fracture of the spine, uveitis, urethritis and amyloidosis. These are the complications of ankylosing spondyloarthritis. So reactive arthritis often follows gonococcal urethritis or GI infections. So there is a REITER syndrome. This syndrome is comprising of arthritis, urethritis and conjunctivitis. Patients are HLA-B27 positive and they are often in the age of 20s or 30s. There is autoimmune reaction initiated by prior infection of the GIT. So the patients feel low back pain and joint stiffness, REITER syndrome. Ankles, knees and feet, they are more commonly affected. There is recurrent arthritis, tendinitis, fasciitis and lumbosacral pain. In addition to articular involvement, there is also extra-articular involvement, conjunctivitis, balanitis, and then cardiac conduction abnormalities and aortic regurgitation. So then is psoriatic arthritis, HLA-B27 positive. There is chronic inflammatory arthropathy that affects peripheral and axial joints and is associated with psoriasis, chronic skin disease. Arthritis associated with inflammatory bowel disease, ulcerative colitis and Crohn's disease. There is also autoimmunity and associated extraintestinal arthritis. So this is the X-rays of ankylosing spondylitis. There is inflammation and then fusion of the intervertebral space disc, advanced ankylosing spondylitis. This is normal spine. Then is infectious arthritis or suppurative arthritis. May result from nearby osteomyelitis, and it is often caused by gonococcus in or H. influenzae in children, Staph aureus in adults, and salmonella in sickle cell disease patients. There are 4 cardinal signs, that is fever, leukocytosis, and raised ESR, and joint pain. Other infections which may cause arthritis is mycobacterial tuberculosis. Maybe patient of pulmonary tuberculosis, they may also show involvement of joints like knee joint. Then Lyme disease is a spirochetal disease, and they are transmitted by ticks. Then certain viruses, they may produce viral arthritis, parvovirus B19, rubella virus, and hepatitis C or B virus. So that is about the infectious arthritis. Next time we will discuss about certain tumor-like lesions of the joints, inshallah.